Hello, good morning to everyone, or good afternoon, depends on where you're based on. And welcome to the CleanMed session, How Clinicians Can Reduce the Environmental Impact of Healthcare. This session will be led by two physicians, and we will be also presenting an initiative of Healthcare Without Harm Europe at the end of the session. But before we go on the program, I would like to explain you a bit more about Healthcare Without Harm Europe. We are a non-profit European network of hospitals, healthcare systems, local authorities, academic institutions, and environmental and health organizations, and we work with the countries of the WHO European region. However, we are part of a bigger movement, of a global movement, and Healthcare Without Harm has offices in Europe, US, Southeast Asia, and a virtual team in Latin America. We also work with partners around the world in Australia, China, India, and South Africa. Our mission is to transform the healthcare so that it reduces its environmental footprint and it becomes a sustainability leader in the global movement for environmental health and justice. We have currently 151 members in 33 European countries, and just over a half of our members are health providers. Like I said, our mission is to reduce the environmental footprint of the healthcare sector, and health professionals have a very big role to play in this mission. Clinicians are one of the most trusted voices within our society, and they have a unique opportunity to lead and influence the movement towards a more sustainable healthcare system. Today, we are bringing here the voice of two physicians. They will be sharing their experiences about how to engage and empower clinicians in the mission of reducing the environmental footprint of the healthcare system. We have Dr. Amy Collins, who is Senior Clinical Advisor for Physician Engagement at Healthcare Without Harm US and Canada, and also Dr. Jonathan Slutman, who is instructor in emergency medicine in Massachusetts General Hospital and Harvard Medical School. Like I said, they will be presenting, and at the end of their presentations, there will be the opportunity to have some discussion. So please feel free to add your questions in the Q&A chat box, and we will be taking your questions at the end of their presentations. Amy, the floor is yours now, so I will stop sharing my screen, and you can share your screen. Thank you.
Okay, you can see it?
Yes, we can see it. Thank you.
Great. Well, thank you very much for that nice introduction. And it's a pleasure and honor to be able to speak to all of you. I was so looking forward to attending CleanMed again and going to Belgium. But I'm very happy that we have this opportunity to meet virtually instead. And I hope COVID is going to improve and we'll be able to gather in person again. My slides are not advancing. Oh, there we go. I'm going to start with a story, which I usually share at the beginning of my presentations. My journey in the sustainable healthcare movement started back in 2007. I was at the school pickup line picking up my fourth grader. I was sitting in my car, texting, listening to music, and idling. My son came out to the car and immediately reprimanded me because his teacher had read him a story about climate change and polar bears. He told me that he never wanted to catch me idling again and that I had better do more about climate change. I agreed to do it because that's what a mother did. We did what we call the pinky swear, and I told him I would do what I could. I really didn't know much about climate change, so I set out to learn about as much as I could. We then started to do whatever we could at home to reduce our impact. And it soon became very uncomfortable living one way at home and an entirely different way at work. I work as an emergency physician. And I started to wonder why I was leaving my environmental conscience at the door when I walked in for a shift. I started looking around. I noticed all the waste. I started bringing recyclables home. And it got to a point where it really became very uncomfortable. I asked someone if I could start a recycling program, and I was told by a colleague that recycling was illegal in a hospital. So I went to Google and I typed in recycling and hospitals, and I learned about healthcare without harm. I then learned that hospitals have a very large impact and lots of opportunities to reduce the impact. So I got educated. I wrote a letter to my administrators asking for permission to start a recycling program and a green team, and I was given instant approval. It's not always that easy, but it was the right ask of the right administration at the right time. So for about 7 to 8 years, I led the sustainability team at my 2 hospital health system outside of Boston. It remains the highlight of my career. It was the most enjoyable, satisfying, impactful work I have ever done. We had a broad program with lots of employee engagement and community engagement. We reduced waste, saved money, and most of all, we really had a lot of fun. Ultimately, our efforts led to us receiving the highest award that Practice Green Health offers, the Environmental Leadership Circle Award, which we won for 2 years in a row. But for many reasons, that came to an end. But I still, wanted to continue doing this work. So I stayed very involved with healthcare without harm. I worked for the food team for a couple of years, and then I worked on a divestment project, and I unofficially led the physician engagement work. When I went to my first CleanMed, I was the only physician there. And over years, more and more physicians were attending CleanMed. We had a couple of physician pre-conferences. We developed a physician track at CleanMed. And it just became clear to me that physicians were really key. They were absolutely critical to advancing climate smart healthcare and the mission of healthcare without harm. And I, repeatedly had conversations with Healthcare Without Harm and the other physicians. And there was always agreement that, yes, physicians are key, and the organization, should support physicians, but it really was a issue of, lack of bandwidth. So I continued doing it on an unofficial basis. And then my slides are actually backwards. As I was having the conversations with the leadership of Healthcare Without Harm, I really made 2 cases. One is physicians really can provide a lot of value to the organization. And because of that, we need to find a way to support them, or we're going to risk losing them. It was very critical that, clear that physicians have unique opportunities to advance climate smart healthcare through research and education. They could also advance the mission of healthcare without harm. It was also clear that physicians could grow Practice Green Health membership by engaging physicians Practice Green Health is our US-based membership organization. It was clear that by engaging physicians, we could potentially get more hospitals to join Practice Green Health. It was also clear that physicians were key in providing guidance for certain programs. I think the clearest example of that is our Greening the OR program, that anesthesiologists and surgeons really were key in having a role in developing those programs. And it was also clear that we needed to provide a home for physicians and support them, or we could risk losing them. And it was also clear that we needed a liaison between physicians and Healthcare Without Harm and Healthcare Without Harm and the other physician organizations. But as I said, at the time, the organization did not have the bandwidth. And that brought us to 2016, where we had an election. And after the election, I made a commitment to really up my environmental work, because it was so clear that there were going to be that some of the progress we had made was going to be negatively impacted. And at that point, I reached out to Healthcare Without Harm, and this time they agreed that yes, it was the time. It really was the time to support physician engagement, and there were many opportunities to leverage physician, expertise and voices in the climate fight. So I was given permission and had to spend some time really thinking about who we wanted to be, how we were going to support physicians, how we were going to provide value, and how we were going to be different from the many other physician climate and environmental organizations. We also wanted to be clear, we wanted to make sure we were not competitive and that we were collaborative, and we didn't want to duplicate efforts. And what I did is I put together an advisory committee. Jonathan is part of the advisory committee. And as a result of many interviews and conversations, we ultimately defined our 3 goals, which were to create a network of physicians interested in promoting climate-smart healthcare through mitigation, resilience, and leadership, to lead and support physician action to reduce the environmental impact of healthcare delivery, and to engage physicians in advancing the broad agenda of practice green health and healthcare without harm. So we launched in early 2018, and our network has grown since then. We started with a group of about 10 physicians, and as of today, we have 652 members, including many medical students from many institutions around the country, from many states, medical schools, and many specialties. I want to point out that our work supports physicians who are taking action within the hospital setting, and many, if not the majority of our members are hospital-based physicians, anesthesiologists, emergency medicine physicians. We're seeing now radiologists, pathologists, hospitalists, surgeons, physicians who practice, within the 4 walls, who are presented on a daily basis with the waste and are interested in opportunities to reduce the waste. I want to say that, the numbers really don't tell the story. What tells the story is the remarkable work that these 652 members are doing. So I support physicians who have broad interests, healthy food, purchasing, greening the OR, safer chemicals, all our program areas. However, our focus now is on climate smart healthcare. And that is for a couple of reasons. First of all, I work under the Climate and Health Program. It was where the organization felt that physicians could have the most opportunity to leverage our voices, our health expertise. The Climate and Health Program supports the health sector in a 3-pillar strategy: mitigation, so reducing the carbon footprint of facilities; resilience, building resilient hospitals; and leadership, mobilizing healthcare's influence to advance climate solutions. The other reason the network is focused on climate smart healthcare is, it is an organizational priority. And it's currently a crisis. We talk about the climate crisis, but it's also a public health crisis. Climate is going to have broad impacts on the health of people. As healthcare providers, as frontline providers, we are going to be seeing these patients with increased burden of disease. Also, extreme weather events can impact healthcare delivery, supply chains, and access. We've seen many examples of that with recent wildfires and floods. And as physicians, we want our healthcare facilities to be open during an extreme weather event so we can provide care to our patients, and our communities. And also so we have a facility to work in. There are stories where health facilities have been impacted by extreme weather events, such as NYU Langone in New York after Superstorm Sandy in 2012, causing the emergency department there to be closed for 18 months, the OR to be closed for months, and it also caused over 500 physicians to seek privileges elsewhere. So we want our facilities to stay open following extreme weather events. The third reason is because the healthcare sector contributes to climate change, and clinical care is a significant factor in driving healthcare pollution. Jody Sherman, who I'll mention a couple of times, refers to it as the single largest factor driving healthcare pollution. The other reason is our medical societies in the United States are calling on physicians to get educated about climate, take action both inside and out of the hospital. But there are many medical societies that have issued policy statements and position statements specifically calling on physicians to lead action to reduce the carbon footprint of healthcare delivery. The next reason is it's what our members want. When members sign up for our network, they indicate what their interests are. 77% of our members indicate that climate and health is a primary interest. So we really have to meet the needs of our members. And it is very clear that the overwhelming majority of physicians and medical students who sign up for our network do it because of an interest in climate and health. So, how do we define physician action? What are the different ways that a physician can get involved? And it's really, there's no one size fits all. One of the things that I have found so exciting and impactful about doing this work is getting to know the different physicians in our network, helping them find their voice and how they want to take action. And there are really no two physicians in our network who are taking action the same way. But we defined action into these different categories, which I'm going to go into in a little bit more detail. So first of all, physicians can take action within the four walls of their hospital. There are endless ways to do that. Physicians can start a green team. They can join a green team. They can ask their administration to commit to greenhouse gas emissions, join Practice Green Health, join the Healthcare Climate Challenge. They can start a greening the OR team. Or they could take on a, specific project such as encouraging their food services department to serve less meat and more plant-based options. They could start a recycling program. Really endless opportunities for physicians to get involved, and it's just been very, interesting to see the different ways that our physicians finding a way they feel they can have the most impact. I want to talk a little bit about physician choices. I am a practicing physician. Jonathan is a practicing physician. Every single day we have choices. We have choices about the medications we prescribe, the devices we use, the tests we order, how we dispose of waste. But it turns out those choices, those day-to-day choices, can have a really big impact on climate change. So why is that? There are three sources of greenhouse gas emissions in healthcare. Scope 1 are direct emissions, scope 2 are purchased, and this is a very short summary, and 3 is basically everything else. It turns out scope 3 emissions have the biggest impact. I think about 68 to 70% of healthcare emissions are from scope 3. But if you look at what's in scope 3, that's where we as physicians can have impact. We can look at the pharmaceuticals we are prescribing. Does a patient really need, 3 different medications for back pain? Does the patient with sinusitis, need an antibiotic? Really use evidence to make our prescribing decisions. We can look at the devices we use. Should we be using a single-use disposable device or a reusable device? We can look at how we're disposing waste, make sure we're disposing of waste and segregating it in the way we're supposed to. So I think this really illustrates that, as physicians, we have the opportunity to take action and really have significant impact. I'm going to talk a little bit about other ways that physicians within our network are taking action within the healthcare, the 4 walls of the hospital. These are 2 physicians. They're both anesthesiologists who both started out within the OR, leading action within the OR, and they ultimately ended up making pitches to their administration for compensated sustainability positions. So they both have director level sustainability positions, and this is really like the prize. This is what I did, and I feel that it is really very valuable to have a physician leading sustainability efforts in a hospital, because we understand, clinical practice. We're ground level workers. We really see those impacts, and we, understand the opportunities. What I'm seeing now is that there are physicians within our network who are really taking a deep look at their specialties and really creating movements within their specialties. This all started with greening the OR. Anesthesiologists have been involved with the greening the OR movement for years. They really started, with this movement, looking at the very unique opportunity, the impacts in the OR, and taking action to reduce the impact. But we're seeing that with other specialties. Alyssa Gordon is a pathologist she's really the pioneer of the greening the labs movement. Again, looking at those unique, sources of waste and pollution in the lab. We now have a group of radiologists who have come together to form a working group within our network, starting, looking at creating a similar movement within radiology. A new network member is an interventional cardiologist who does a lot of work in the cardiac catheterization lab. She started a program at our hospital called the Big Green Cath Lab, and is now having conversations with her medical society about having the society as a whole make a commitment to coming up with some, actionable opportunities within the cath lab to reduce their specific impact. And Jonathan and I have done some work with creating a similar movement and awareness campaign within emergency departments. Research is really, really critical, and I think a very important way in which physicians are advancing climate smart healthcare. Jody Sherman is really one of the leading researchers. Her work has just been so important to us in providing us data and allowing us to use evidence-based talking points. She was the physician who did the research which found that the healthcare sector is responsible for 10% of US gas house green emissions. I use that talking point daily. She's done a number of life cycle assessments, such as the anesthetic drugs. And one that I refer to regularly, a life cycle assessment study where she compared reusable versus disposable laryngoscope blades. And I use her findings regularly. Every time my hospital or my department comes and says, okay, we're going to switch to disposable laryngoscope blades, I'm able to pull up, the results of the study and share them with my group. So research like this really allows physicians and sustainability professionals to make evidence-based clinical and device use and procurement decisions. We found that physicians can be very, very powerful, and influential educators. There's no shortage of the different ways that physicians, can educate their peers, their communities, their patients. And we support physicians in their education by having a speakers bureau and providing support with presentation development. The media, engaging the media is another way to take action. Doing things such as writing letters to the editors, op-eds, providing interviews, blogs, and podcasts. And we now have, this large network of physicians that we can turn to, when we get a request for an interview, when there is a need for a physician in a certain state, or with a certain expertise to write a letter to the editor, to the op-ed. And we provide support for doing so. I want to talk a little bit about social media. I think social media can be a very, very powerful advocacy tool. And I think there's opportunity to spread the word about our work, to elevate our members' voices. One of these, I promoted and shared research that Jonathan did with a medical student. So I think it is, a way to engage and educate and draw attention to our work. I just want to share a little story about how social media can personally have impact. Last year, I gave a family medicine grand rounds at a hospital in Washington, D.C. Someone who participated in the session tweeted with one of my slides. So it turns out that another physician read that tweet. He was a director of a family medicine residency program, contacted me, joined the network, and we met. And as a result of this, he has made a commitment to integrate climate change and climate smart education within his residency curriculum. So social media, I think, can be very powerful. And we have a guidance tool for physicians for social media. We also have a Facebook group, which is an imperfect forum, but I think it has been somewhat of a valuable forum in having some discussion, educating and engaging physicians who are not aware of the health impacts of climate change or the environmental impact of healthcare delivery. And it's also a good way to share advocacy and educational opportunities. Public policy, I do want to go back and say, when we talked about the different ways that people can engage in our network, either within the hospital walls, as educators, researchers, clinical practice, when people sign up, they indicate how they want to involve, and it's really spread across the board. Engaging in public policy, I think, is either the second or third way that physicians want to engage. So we feel that it's important to support physicians and provide them opportunities. So we have supported physicians, including myself, meeting with legislators in Washington, D.C., helping arrange meetings, providing talking points. We've also supported physicians in providing testimonies. at the state level in response to certain call to actions. Again, back to a point I made earlier, it has been really valuable to us as an organization to have this army of physicians we can call on when we have a need for someone with health expertise to provide testimony. Clinical practice, there is really no, shortage of ways that physicians can engage. Lots of opportunities to engage patients at the bedside by having conversations with patients. I will, when I remember, have conversations with patients about proper medication disposal. We've talked a little bit about clinical practice, how during our day-to-day clinical practice, we can really look at the choices we make when it comes to the tests we order, the devices we choose, the pharmaceuticals we order, and how we segregate waste. I think we also can, during our day-to-day clinical practice, educate our colleagues. I have a colleague, a physician in my department, who people now call her the new Amy, because she's always reminding people, that should be going in the recycling bin, that should not be going in the red bag bin. Do you know that the healthcare sector is responsible for 10% of US greenhouse gas emissions? So she really has been sort of this champion and messenger sort of throughout her shift, educating colleagues. So how do we support physicians? We do that in a number of ways, through fact sheets and other resources. We provide a monthly newsletter. We have created a Physicians in Action profile series, which really shares the unique stories of how our members got started, what's important to them, and the unique way that they are taking action. Mentorship is key. When physicians, as I said, when members sign up for a network, they indicate, how they want to engage. A large number of people who join want to be mentored. Jonathan is my go-to mentor for research. I have a go-to mentor for people who want to engage in advocacy. We recently launched a virtual journal club, which Jonathan leads, as a way to discuss some of the recent articles that are related to climate change and health or sustainable healthcare. And we've also started to form working groups, connecting members and starting working groups. I do want to say that I think what has been very critical in my ability to connect members and form working groups is really getting to know my members. So far, I've been able to offer to speak to every single, all 652 members who have joined our network. I send an email, I offer to speak to them, and I would say about a third I have spoken to. But it's really been very important to know my members, which allows me to connect them to other members, connect them to the appropriate mentors, and to form these working groups. I think the most successful working group we formed was Medical Students for a Sustainable Future, which formed after a medical student leader came to me and asked for an introduction to other medical students. This group quickly formed and grew to a remarkably visionary, productive, and ambitious group. They really are a great source of inspiration to me. They are no longer a part of our network. For many reasons, they felt that they needed to be an independent organization, but we still partner with them in a number of exciting ways, and we'll continue to do that moving forward. We also formed another group, which was formed based on members' needs. This is a group of physicians who are in training, physicians who are in their residencies or fellowship, and they have a growing group of physicians who meet regularly, and they are coming up with efforts in education, advocacy, and research. Just want to go back to the working groups. As I mentioned before, we are in the process of forming sort of an unofficial group of radiologists who are very interested in connecting with other radiologists, learning about the work they're doing, and see if they can create a movement in radiology similar to what's been done in the OR and in pathology. And we have a couple of other working groups that have very casually formed, but again, a good way to connect members and allow them to grow this work. Recognizing the value that medical students and physicians in training provide to us and wanting to support them. A couple of years ago, we launched the Emerging Physician Leadership Award and Scholarship. This is a physician-funded scholarship which allows a medical student or resident to attend CleanMed. And we were able to grant 2 awards in 2019. This year, we were able to grant 4 awards, but unfortunately, we were not able to gather in person to celebrate the award winners. So, how are we doing? What have we learned? What have the challenges been? I think data is very important in understanding how we're doing. I shared with you already some of the data we use, how our members want to engage, what they're interested in, and how we customize our work based on our members' interests. We also collect analytics from our monthly newsletter, and the analytics have been very positive. Our newsletter has the highest open rate in our organization and also a high click rate. We know that in our newsletter, like in a typical newsletter, people just click on the first couple of links, but we know that in our newsletter, people are clicking throughout the newsletter so that we know that people are reading it. And we've had very few, I think just one person unsubscribe from our newsletter. So what we've learned from this is what is valuable to our members is in our newsletter, we elevate the voices of our members and the work that they are doing that is relevant to the goals of our network. And we also share healthcare without harm and practice green health resources, and toolkits and, educational events. So we really focus on the needs of our members, promoting, healthcare without harm and practice green health, and sharing, physician relevant content that will help them do their work. We've also learned some things from webinars. These are the webinars, the top webinars from 2017 to 2019. The top 5 are highlighted in red. What's important to know about those is the first 4 were physician-led or nurse-led. The first one was nurse-led. Nurses are always going to beat us, but the 2, 3, and 4 were physician-led, and 5 had physician and nursing speakers. So what we know from this is that, our audience really recognize the value of physicians and nurses, as expert speakers and valuable educators. So moving on to this year, this was one of the webinars we did for our CleanMed virtual series which was led by Jody Sherman, who I've mentioned, and Jonathan, along with Cassie Thiel, who is a researcher. And this webinar broke all records for us. We had 567 people register, again, really reinforcing that our audience really wants to hear from physician expert speakers. We've also gotten some feedback, which is very reassuring and satisfying to me. The first feedback I share with you really speaks to the importance of us providing a home for people who don't want to do this work. This was a medical student who expressed how she finally found the home she had been looking for, and it allowed her to do really remarkable work. You may remember at the beginning of my presentation, I said, one of our goals when we talked about why it was important for our organization to support physicians and medical students is to provide a home. The second feedback is from an anesthesiologist who found content in one of our newsletters that allowed her to bring the content to her surgeon in chief, which ultimately led to them making a commitment to a sustainability program in the OR. So, it really speaks to the fact that we have accomplished what we set out to do, is provide a home and also provide our members with the tools and resources they need to take action within their settings. So what have been some of our challenges and lessons learned? I have to say, as I was putting together this presentation, I was looking, through my photos for a challenge photo. I was looking for maybe a hiking photo or a biking photo. And then it occurred to me that probably the biggest challenge I have faced in the last many years, is the current COVID challenge. So what are some of the challenges we faced? I think the current challenge is COVID. Physicians are consumed with COVID. Many of our physicians, but not all, are on the front lines. And it's not necessarily a great time to be asking physicians to do more. However, I think there have been a lot of lessons learned from COVID. We've many similarities between the COVID crisis and the climate crisis, which I think has given us some opportunities to further explore that. I think another challenge has been that there are currently so many public health and social justice calls to action. Not all physicians engage in advocacy, but those who do have so many other things they're engaging in, gun safety, immigration rights, the COVID crisis. I mean, they're endless other calls to action for physicians. Not everyone is going to find that climate is, where they're going to focus their advocacy opportunities. But my job is to try to elevate climate to the most critical physician public health advocacy opportunity. I think, another challenge is that there's still many physicians who are not aware of these issues that I've talked about, how climate change impacts health and healthcare delivery, and how the healthcare sector contributes to climate change. But I think that gives us an opportunity to try to continue to educate and raise awareness. I think another challenge is that there are many other physician climate environmental organizations, but I think that has presented us with an opportunity to partner with these other organizations, to elevate each other's work and messages, and to work collaboratively on projects. I think lessons that I've learned is it's critical. It's been critical for me to know my members. The members that I've gotten to know, I know well. And that has allowed me, as I talked to before, to connect members. I think another lesson I've learned is it's really important to try to empower and elevate the voices of members. Um, there, there are many physicians who are well known. They are often asked to speak. They are often asked to, submit publications. But we now have, as I've said many times, an army of physicians and medical students, some who are just getting started. And I've found that it's been very valuable to try to elevate, to empower, and then elevate the voices of some of our newer members. I think, another lesson learned is that there's always an opportunity to focus on what we are all about, the environmental impact of the healthcare sector, how the healthcare sector is contributing to climate change. I'll often get asked to review, a presentation or a publication. And it's not at all unusual for the publication to say how climate change is impacting health. But I think, and what I found is there's opportunity to bring that one step further and include content about the broader link between climate change, healthcare delivery, and how the climate change and how the healthcare sector contributes to it. So we're not all the way there yet. We still have a lot of work to do. Moving forward, the kind of questions that I'm asking myself and asking in my advisory committee is, how do we build a stronger leadership structure? How do we provide even more value to our members now that we've built up this 650 plus network? How do we provide more value? How do we build community by providing more network opportunities? How do we further empower and elevate the voices of our members? And how do we have an impact? And how do we measure that impact? And how do we get our members to really be proud that they're a member of our network and have a sense of pride? And this became clear to me from the medical students, who have incredible pride and sense of ownership of being a part of Medical Students for a Sustainable Future. They use it as part of their title. They have it on their LinkedIn profiles. And I think we have an opportunity to do the same with our members. I just want to close talking a little bit about how far we've come. And hope. As I said before, when I started, I was the first physician at CleanMed. Then we grew to a core group of around 12 physicians who are CleanMed regulars. And over the past 4 years, we have grown in ways that I have never imagined. I've just been so inspired to see how physicians have found their voice and how they want to take action. And over the past 4 years, our members have given hundreds of presentations, developed med school curriculum, spoken on webinars, written publications, done research. It's really been remarkable, and it is what gives me hope. And I did a lot of reflecting about this, during the fall and the COVID crisis and our upcoming election. We have all these colliding crises. We have the COVID crisis and the climate crisis colliding. In the US, we had some political uncertainty, and it's really all my members and the work that they are doing that gives me hope. Finally, I just want to close. My son, who I spoke to you about at the beginning, is now a 6'2" organic farmer. When I think about all the individual actions we took at home, I think the most important individual action I took was raising an environmentally responsible child. But I really want to talk about, that one person really can have an impact and one person can lead to bigger change. This was one teacher who broke curriculum and read her students a story about climate change and polar bears, who inspired, one little boy who inspired his mom, who then was able to inspire her administrator, who was then able to bring this work to a larger health system. So never think that, one person or one thing you do can't have impact. So with that, I'm going to close and turn it over to Jonathan. Thank you.
Thank you, Amy. It's great to hear in one story the growth of what has become, I think, a very important part of many of our sustainability and environmental careers in medicine. And so I'm going to do my little part to give the view of a physician who is not directly affiliated with Healthcare Without Harm on the physician network. I think I'm stretching a little bit here. As Amy mentioned, I do play a role in the physician network, and I am an advisor to the physician network. But I think that role has only grown because of the role that the network has played in really enabling me to achieve a career definition that fits me. So I'm going to talk pretty briefly now. Amy went into a lot of detail about the network, and I'm going to kind of just nibble on the edges a little bit. So let's start by saying that I have a disclosure in that I have received some travel funding from 3M, the manufacturer, but it bears no bearing on the things that we're going to talk about today. It's really hard to work in a clinical sphere like we do and see so much waste and so much pollution from the care that we're providing our patients. And those of us who recognize this, who see this on a daily basis, can really feel kind of lonely in many places where you might be the only person who recognizes this, and you might be the only person who sees it as a priority. So as Amy mentioned, it's really important for these clinicians to have a network of similarly minded practitioners, of physicians, nurses, pharmacists, physician assistants, and so on, to be able to support each other outside of their home regular work institutions. We need people who speak that doctor language, who can understand the role of clinical care while also talking about the role of environmental stewardship, so that we can keep our people well supported. And for me, what it's turned into is a big role of mentorship and advisorship with respect, in most particularly in the realm of research. I know that Amy mentioned Jody Sherman a lot, who I think is great and is one of my mentors. And I've learned quite a bit from her. Now I try and pass it along to others. So I've been involved in a few projects that have resulted in some pretty good publications, and some of these have involved others that have been able to bring them in. Amy mentioned some emergency department waste work that was done with a medical student from Brown University here in New England. And I've been involved in writing a primer on how to have a climate smart, environmentally responsible emergency department. That was written primarily by an emergency medicine resident at Stanford University out in California. And what started kind of very informally with Amy directing people who contact her and say, hey, I want to do this kind of research project, or how do you answer this question about measuring the environmental impacts of the care we provide, is now a little bit more common that she directs those folks to me, and then I either take them on or I direct them to others, and we create this fostering environment within the network for people to grow in the ways that they want. And the way I describe it is, everybody on this journey needs to do the work that makes them the most fulfilled and that gets them up in the morning, that they feel most activated to do, which may be sometimes the kind of work I do, sometimes might be the kind of work Amy does, but there's always somebody out there who's doing that kind of work, and it's our job to connect them. And that's really what the network is all about. As an individual, for me, the value that I get from the network is that it grows my group of people, my raft of individuals on whom I can rely to get research work done, or identify funding maybe, or identify strategies for how to do things. With respect to physicians, as Amy kind of closed, she said that research is a significant part of some of our physician colleagues' work, and most definitely those in academic medicine. And I think that it's important that we foster that and we grow it as much as possible, so that we can show that environmental stewardship and sustainability are important fields within medicine and are worthy of financial and time support to develop them. I could wax on about too many of the projects that I'm currently engaged in, but more importantly are the projects that people come to me with and say they want to work on. So recent queries I've received about measuring the environmental impacts of hemodialysis, or measuring the environmental impacts of personal protective equipment, or plenty of other things. So the network enables these folks to identify things that they can do. As one of my former faculty members used to put it, if I give any one of you a test, chances are nobody's going to get a 100% score. But if I give that same test to everybody, collectively you will. Collectively, we all know the answers, or we're all able to find them out. So that's the purpose of our network. So let's talk a little bit about where I work. Here is a photo of the Massachusetts General Hospital. This photo is from 1901. The hospital was founded in 1811, which makes it one of the oldest healthcare institutions in North America. It looks a little different today, but that's still where I work. And that building that's covered with ivy in the foreground is still there. And what I do is, over the last 3 years, have grown a network of clinicians, both within Massachusetts General Hospital and our parent organization, Mass General Brigham. We've created a physician sustainability group with like-minded clinicians, mostly physicians, but other clinicians as well, who are each doing slightly different things in environmental stewardship. And we have grown significantly what the institution itself is doing. So with some great effort from a number of clinicians, we advocated and were able to create an executive level sustainability committee at the hospital, which is no small task at a hospital that's over 200 years old. And we have some great news to announce in the coming month or so, that the executive sustainability committee is going to be growing even greater, with some pretty significant financial commitment from the institution to ensure that that our leadership position becomes even stronger. I mentioned the research work that we did with Sarah Sue from Brown University, and here's a tidbit of that result. That what we did was, at her urging and with some brainstorming on my part, we developed this project to measure the environmental impact of waste from the emergency department. So over the course of one day, we collected all of the waste, and here you go. Pollutants from one day of emergency department waste, just getting rid of the waste, is equivalent to driving a car almost 8,000 miles. I beg your forgiveness for using miles, but we here in the United States do that. And so the messaging becomes that much stronger when you say, this is actually more than I drive my car in a year. And that's one day of emergency department waste. This work grew directly out of the physician network and the connections that we have. It involved an environmental engineering professor, an emergency physician, an academic, another emergency physician, and a medical student. So we already have pretty good cross-representation of levels in career development, all because of the physician network. So it brings me to a closing where, what's our vision? What do we see on the horizon? What is out there for us to do and grow? And I would say that a physician network does a lot of things. It's a social and technical network for clinical healthcare professionals. It's an educational outlet. It's a place for interested clinicians to become activated and knowledgeable clinicians, whether it's through the journal club or webinars or sharing written materials or developing those materials so that we can share them with our colleagues not in the physician network. It becomes a bridge for clinicians between the clinical, the executive, and engineering leadership in our institutions. Most of our clinicians obviously aren't environmental engineers, but those principles are needed to understand how to improve our environmental stewardship performance. But at the same time, as Amy has said, quoting Jody Sherman, all healthcare is ultimately driven by bedside decisions by physicians, nurses, and other clinicians. And that's what drives our environmental performance. All three of these groups, clinicians, engineers, executives, have to end up on the same page. And the physician network can give clinicians the tools to work in these liminal, these border spaces between the groups. And then finally, the network gives a forum for advocacy. It becomes a trusted source for public statements and potentially a space for our elected representatives, our media representatives to find those trusted sources to ask questions and to get those quotes they need to move the needle forward. As far as what I think we can do between a North American physician network and a European physician network, the opportunities are almost endless. That I think there are great opportunities for cross-border collaboration. While there are definitely different regulatory regimes that affect the care we provide, many of the environmental challenges are the same. And when it comes to research, we all know that multi-site studies are much more impactful and valuable in changing people's minds and moving that needle. So this gives an opportunity so that we can work together. And then finally, we can learn from each other, and the best practices at one institution might be different than the best practices at a different, and hopefully we can gather those best practices. And again, by working collaboratively, we can together get the 100% on the test. So with that, I'll say thank you. And Amy and I are, of course, happy to hear any questions you may have, both synchronously online now or certainly later as they arise. So thank you.
Thank you, Jonathan and Amy, for these very inspiring presentations. And yes, we actually have some questions coming in and comments that if we don't have time to go through all of them today, they will stay in the platform in Cuba. But we do have some time for questions now. So I will be putting this to our speakers. And the first question, and it's for both of you, is coming from Tim Malone. Why do you think so many physicians and other health professionals still don't see sustainability and green health as part of their remit? And do we see ourselves as too busy saving lives to care about the issue?
I can start. I think it is lack of awareness. I think physicians are, so involved in their day-to-day clinical job, taking care of patients, that they don't see what's around them. But I think the biggest issue is that they haven't received any education about this. I didn't receive any education about climate change and health or sustainable healthcare during my training. I imagine Jonathan didn't either. I have found, though, that once a physician or a nurse or other healthcare professional gets this education, it is a very big aha moment because they have never thought about it. So I think, there's definitely, there's a barrier or a gap, but it presents us with this huge opportunity to educate physicians. When physicians and other healthcare professionals learn about the magnitude of waste in healthcare, about healthcare, how healthcare is contributing to the climate crisis, it really, I have found, again, is this big aha moment. And then they are able to start seeing the waste. And once they start seeing the waste, they can't stop seeing it.
Thank you, Amy. Jonathan, yeah, please go ahead.
Yeah, I think Amy is spot on. I think that there are probably, as in most things, three groups of people that we're gonna encounter. One are the folks who are very focused on the care they provide and want to do the right thing in all the spheres that they're working. They want to do the right thing for their patient. They want to do the right thing for the community. They want to do the right thing for the environment. And when presented with data, they want to change their practice so that they do better because that's what they want to do. At the other end of the spectrum, you have folks who would say, the patient in front of me is my primary and only concern, and I am going to move heaven and earth. I am going to do anything that I possibly can, spare no expense, and do whatever is necessary to save the patient in front of me. And there's a lot of value in that kind of a statement. There's a lot of thought behind it, and I don't want to say that it's wrong. But those folks are a little bit harder to convince that we should do things differently because their statement isn't wrong. It's just different. And then there are the folks in the middle who really just don't know where they should be. And they're kind of willing to go along with the flow one way or another. And if their institution tells them, all right, you need to recycle this, or we're going to be using reusables now, they're going to say, oh, okay, I'm gonna do that because that's the path that is before them. I think the ones that we need to affect are the ones who are the decision makers. And I think, look, I just presented at a very significant meeting last week at my institution at the Mass General Hospital, that the General Executive Committee, which is made up of the CEO, the CFO, the CEO of the medical group, and every department chair, as well as has representatives from the executive level of the parent organization. So there are about 50 people in that group, and these are the people who make the decisions. And at the conclusion of my presentation, the questions that I got were all basically, wow, we're wasting so much stuff. This can't be good. So there is plenty of opportunity to move the first group to be more active, which will drag the third group along. And then I think the second group is where it's going to take a little bit more effort to show that we can do more good for more people by protecting everybody.
Thank you, Jonathan. And there are some comments and follow-up questions to this single question. So later after the conference, Amy and Jonathan will have the opportunity to follow up on this. Another question we have for Amy, and this comes from David Brasfield, is how often are you able to make sustainability interventions in pathways of care as opposite to individual products used in existing pathways? And do you know of any good and reproducible models for the pathway approach?
I think this is a question for Jonathan.
Okay, so I will pass it to Jonathan in this case.
Can you repeat the question?
Yeah, sure. So how often are you able to make sustainability interventions in pathways of care as opposite to individual products using existing pathways? And do you know of any good and reproducible models for pathway approach?
That's a great question.
Yeah.
The short answer is yes, that we can adjust pathways just as we adjust products. I think the two are intimately related. The tool that Jody and Cassie and I and others use the most when doing this is life cycle assessment. And it's designed to address any product or process. And it starts with a process map. What you end up learning pretty quickly is that the processes are made up of using different products. So adjusting the products by necessity adjusts the processes, which it gets pretty confusing to use this language around, but really the tools exist. As far as what's been done already, the one that comes most to mind is renal replacement therapy, so dialysis. There has been some work looking at the differences between hemodialysis versus peritoneal dialysis as two very different but similar end result care pathways. And the environmental impacts are quite different. So there is some work there. I think ultimately there was really a great slide in our session last week about circular economy in healthcare, and I was talking about waste, and we had a representative from the VGR region in Sweden who was talking about hip replacements, and that you could talk about reducing the environmental impact of a hip replacement procedure, but really what's more interesting and more valuable is talking about what kinds of interventions can be done to reduce the need for hip replacement procedures to begin with. And that's kind of a process improvement that takes a lot of upstream work and takes a lot of lead time to yield fruit. But ultimately, that's the kind of assessment that we should be talking about. The reality, though, is if we're going to be talking about an environmental crisis or a climate emergency, then I can't wait 10 years or 20 years or even longer to have fewer people needing hip replacements. I need the hip replacements that we're doing now to be better. And that's through changing OR procedures and processes, and maybe it's reusable versus disposable equipment. Maybe it's opening fewer packages. Maybe it's tailoring the OR packs. Maybe it's changing the ventilation system. So there are lots of individual products or procedures that can be tweaked and adjusted within a greater process. And the process as a whole can be studied, but it becomes a little bit more complicated a system to make firm conclusions without really large error bars.
Thank you, Jonathan. And sorry, Amy, go ahead.
Yeah, no, I just want to say that, it was an excellent question. And Jonathan, you did a great job answering it. I think I want to share two resources that you might get more information. I put one in the chat, the Green Print, which is a review of some of the existing healthcare emissions research, including life cycle assessment. And I would also encourage whoever asked the question to listen to the recording of the webinar, our recent CleanMed virtual webinar that Jonathan spoke at, and they talk about some of this in more detail. I think you'll get the slides after the presentation, and the link to the recording is in the slides.
Great, yes, we will be sharing the presentation and also the other presentations from the session that Jonathan was mentioning. Thank you for your answers. And I think that this question, or at least to me, it opens like more and more questions to it. Another question now, I think for you, Amy, how do you in practice engage with your members and work out what they want? Is it using analytics, polls, informal discussions with the members? It's from Ruth Ash. She's a GP running a sustainable living Facebook group. So yeah, this comes from her.
Yeah, I think it's a combination of data and individual conversations with members. As I said, I've been fortunate to have the opportunity and time to speak to many of our members and learn what is important to them individually. And we do get some data from the sign-up process for the network where our members will indicate what their primary interests are. Again, we found climate and health as a primary interest, so we have to recognize that and make sure that our work and our resources align with our members' interests. And we do use other data from learning what people are interested in clicking in our newsletters and webinars. But I really think the most important way I learn about what our members' needs is through individual conversations with our members.
Thank you, Amy. And there is another question. I think it can be for both of you. Also coming from David Brasfield. He says that there are several organic wine producers that don't inform about being organic on their labels. The reason is they feel it will divert attention from what they feel is most important, taste and quality. At my hospital, he says, we have many doctors who are very concerned about sustainability, but who don't want to be branded as environmental freaks. How can we make it okay for these closet environmentalists?
To make it about health, and the healthcare sector. I'm very clear, I am not a climate scientist. When I give my presentations, I don't start talking about climate and climate science. I talk about the health impacts of climate change and how climate change is impacting our healthcare facilities and the job that we need to do, and how our healthcare sector is contributing to this crisis. I make it about health. I talk about how our medical societies and our journals have recognized that this is a crisis. So I really make it about health and how our medical societies are putting out these calls to action for physicians to lead on this crisis. Jonathan brought up a point before, which I'll reiterate. When you speak to physicians, use data. The data exists. I'd be happy to help anyone with their talking points. I think when you speak to physicians, you have to use evidence-based, citable talking points. And fortunately now we have that. So again, I make it about health and the healthcare sector. And again, refer to how physicians around the world are taking action, medical societies around the world are recognizing this as a problem, and our hospitals and healthcare systems also realize that it's a threat and are taking action. Thank
you. Jonathan, would you like to add something to?
No, Amy's totally right there, that physicians can never argue with the health argument. That it really just boils down to what is the right thing to do for our patients. Just this morning, I read an old essay. It's about 15 years old, written by Art Kellerman, who's a big name in academic emergency medicine in the United States. I think he just finished up as dean of the Uniform School for Health Services, and he had written this essay that basically was his mama's rule, that when you are practicing medicine, there are plenty of times when there might be arguments between different specialists for who's going to take care of the patient, and you can get into the shouting match, but really what it comes down to is, if you would be willing to call your mother and describe to her the situation, and then would she say what you're doing is the right thing? If the answer is yes, then you're probably doing the right thing. But if you can't do that, then you should rethink what you're doing. And I think that applies here. It's if being more polluting is, you think, the right thing to do, then go ahead, try and call your mother and describe it to her and say, well, I want to do what's best for my patient. I want to keep doing all these things, and I'm going to generate tons and tons of trash, and I'm going to generate tons and tons of greenhouse gases. And that might hurt other people down the line. Is your mother going to say, yes, you should keep doing that? Probably not. So really, it just comes down to, why are you doing what you're doing in healthcare? And the answer is to take good care of people, to keep people healthy. So provide the data, and it's really hard to argue with it. I just want to say that I think it's a remarkable coincidence that I read that last night. I always find it strange how the world works, but I read that last night. I also want to say that I think when you're speaking to any health professional, including physicians, about healthcare sustainability, you need to use different messages about why they need to care. The three messages I use are: climate change can impact health,
extreme weather events impact healthcare delivery, supply chains, and access, and the healthcare sector contributes to climate change, because different messages and drivers are going to resonate with different people. And I think you have to know the business case for healthcare sustainability. And I think you have to know it well. The business case for sustainable healthcare is very strong, with many benefits, including cost savings, increased employee engagement, retention, and recruitment, community standing. So I think it's really important to know the business case. And the business case is very hard to argue with.
Thank you both. We also have a question from Jane Moret, who asks if there is a new European physician network at Healthcare Without Harm, which I will be presenting in the next minutes. But before we move on, and like I said, there are plenty of other comments and some more questions that can be answered later. But before we move on, I would like to ask you both, what do you think is the highest value of being part of a network as a physician?
Yeah, I'll go, and then Amy can kind of close it up. And it just comes down to having a community of people around you who are really thinking about and acting towards the things that really matter to you. That there are very, very few healthcare institutions around the world where there is a critical mass, a large enough group of clinicians who are doing this kind of work. And it's really hard to do this work without the village around you to help and support you. You know, even at Mass General, which we have 28,000 employees at our parent organization, we have 80,000 employees. If there are 4 physicians who are actively doing the kind of work that I'm doing at MGH, I would be surprised. You need that network to bounce ideas, to get support, to be encouraged, to get data, to share the load. I think it's absolutely critical to have those people around you to keep your tank full, to keep doing the work.
Yeah, I would echo it, echo what Jonathan said. I think the biggest value is our community. The community nurtures me. They're my people. They become my friends. They were the first people to support me during the COVID crisis. But I think our community is really the biggest value. I think mentorship is also very valuable. And I think, you know, access to the resources and tools that are going to allow our members to do the work that they want to do, and was the reason they signed up for our network, as opposed to another physician climate organization.
Thank you, Amy, and thank you, Jonathan, for your also inspiring answers to the questions. And just a last reminder that you can keep engaging in the Q&A chat box. And now I will be moving to the last part of the presentation to present our network, the network that we have been working on at Healthcare Without Harm Europe, and that we launched last Friday, and that I will be explaining more about it in a second. Thank you, Amy and Jonathan. I will be sharing my screen now. But before I move on, as you know, this year is the first time that CleanMed Europe goes online, and we have waived all the fees for attendees because of the COVID challenges and uncertainties. Instead of the fees this year, we ask attendees and your organization to consider making a donation to Healthcare Without Harm. With your support, we can continue to connect sustainable healthcare leaders. And as you know, we are a health nonprofit organization, and our work relies on the generosity of our funders. So thank you for considering making a donation. My colleague Aidan, who is moderating the chat, will paste the link there, but you can also find the link to make a donation in our CleanMed Europe website. Amy's and Jonathan's presentation was a great prelude to announce our new Doctors for Greener Healthcare network. This network will bring together doctors from across Europe to collaborate, share best practices, and advocate for a healthy future by reducing the environmental impact of healthcare. I have to say that we have been very much inspired by the work that has been done by the Physicians Network that Amy presented. So we will be replicating most of the things that Amy presented, but of course, taking into account the European context. The role of Healthcare Without Harm in this network will be to provide platforms for networking and collaboration to the members of the network, and also to offer guidance, support, and advice to take action. We will be also offering training in different topics related to our program areas and offering tools and resources to our members. For the members joining this network, they will obtain the knowledge and skills to succeed as leaders, both inside and outside of their hospital or practice setting. They can learn proven strategies for building sustainable healthcare operations, as well as gain access to the latest tools and resources to support their work on sustainability activities and projects. They will also be alerted to advocacy actions and opportunities, and be inspired by a growing network of engaged health professionals. And they will also have the opportunity to shape the next sessions of the future CleanMed Europe conference and other Europe conference events. The membership of this network is open to individual doctors and medical students, and is based on an individual commitment to the goals of Healthcare Without Harm Europe and a desire to participate in helping to achieve them. You can find out more and join today in this link. The link will be also shared in the chat, and you will need to fill in an application form, and then you will be added to a mailing list. You will receive a quarterly members newsletter, and we will be also asking the members to join a Telegram group. The Telegram group will serve as a platform for the day-to-day communication and also to share opportunities, advocacy activities, and any other activities that might come up. So we hope that you found this presentation very inspiring, and that the clinicians and physicians that are joining feel ready to join our network. It's something that it's new, that we didn't have this home, copying the words of Amy, we didn't have this home specifically for clinicians at Healthcare Without Harm Europe. So we are very glad now to be launching this network, and we hope that many of you will be joining. Before closing this session, I would like to remind the next session of CleanMed, because we have still lots of sessions coming this week. And tomorrow we have sessions on sustainable food, safer pharma, and climate smart healthcare. So please check the agenda, and we also hope to see many of you then there. And like I mentioned before, please continue networking and interacting in the Huba platform, because this will stay up until next Friday, 4th of December. So just wanted to also mention that a lot of this work have been financed by the support of the European Commission's LIFE program. And now, yes, I would like to thank again our speakers. Thank you, all of you, for being here. We hope that you found it interesting. For the comments I've seen in the chat, it was really an inspiring session. Lots of comments to follow up, lots of new ideas. So please continue here with us and have a nice day. Thank you very much.